Thank you for staying with us.
Now let's get the show on the road. On Monday, the first phase of the relaxation of the lockdown began, and to the amazement of many, none of the guidelines we had been given was obeyed. No social distancing, no use of masks, even though there was more use of masks than social distancing. It was like prisoners let out of a cage. In fact, it was so bad that the presidential task force is saying that government may be forced to impose another lockdown. So, what are the benefits of easing this lockdown? What are the pros and what are the cons? We have with us in the studio Dr. Oluwajimi Shodipo, who's a consultant and the chairman, Medical Guild, Lagos. Good morning.
Good morning.
And thank you for joining us.
Thank you.
Yes, Dr. Shodipo. The lockdown was eased on Monday. We have heard, during the week, we heard all kinds of opinions about that lockdown. Some of you doctors have said that we hadn't reached a plateau. The figures were still rising and the government had no business easing the lockdown. What are your thoughts?
Thank you very much, and again, thank you for having me here. Well, the first thing I think we need to start with is for us to understand why there is a lockdown in the first place. The whole aim of the lockdown was to enable the government and its partners to ensure that, number one, we have aggressive testing and results coming out quickly, such that anybody that is found to be positive can be quarantined or isolated. For those that are positive, they'll be isolated. For those that are contacts to the positive people, they are quarantined for at least 14 days, with the ultimate aim of preventing community spread. Within that time period too, there was supposed to be a lot of interactions with stakeholders and ensure that we're actually carrying out a response that is apolitical, because I'm going to get to that. We may get to the situation where other factors affect this response and the response fails. Unfortunately, as has been ascribed to a lot of government officials, that was not done. So we have a situation where currently testing is not as adequate as it should be. Even for those that have been tested, we're not getting results for them. This has led to community spread of COVID, because remember that when COVID first started, majority of those affected were people that were coming in from other parts of the world, and they were easily detected and easily identified. But right now it's in the community. Anybody could have COVID. So based on all this, we can't even say where we are in terms of the epidemic. We can't say, everybody talks about, have we gotten to the peak of the curve? We don't even know where we are in the curve, because we're just somewhere, because we're not. To get there, you must be doing adequate testing, you must be following your numbers, and you get to the surge where you have a maximum number, and then you start coming down. And that can only be done when you are aggressively testing people, and then you know the maximum number. But we've had this wax and wane. Remember, there was a policy by government, like for example in Lagos State, go to the local government, collect samples. How many of them have come out? And even those that came out, when did they come out? For example, if you took my sample today, and maybe 2 weeks later you now called me that my result is positive. I mean, what does that really mean? Because
you had 2 weeks to spread it.
Exactly. And without us being able to, because the aim was test me, if I'm positive, quickly within 24 to 48 hours, get me out of the population into isolation so that I don't spread it. And everybody I've had contact with also be able to test them so that, monitor them for 14 days, and then if they develop symptoms, test them so that they don't spread it to others. And that is the model in every system that has worked. Unfortunately, we've not gotten to that point. So our own assessment is that, number one, the lockdown should not have been eased without these critical issues being resolved. But again, I'm not going to sit down here and assume that it's not a difficult decision. We know that people have said, what are the benefits? What are the disadvantages? To me, there are only two benefits. One, you've just shown a video, people worried, our livelihood and things like that. Yes, we know there's an economic issue that has to do with COVID, especially for those that are not in formal employment, the informal sector. And two, if you look at it holistically too, there's sort of a mental issue. As Nigerians, people tend to go about, we're not used to staying in one place, unlike some other cultures. So, of course, that was why Imeki was Imeki was relaxed. People just, as if, you just opened the gates of a prison. Everybody just, let me get out, let me get out. So, on that could be said to be an advantage, but the disadvantages are going to be much more. And we're already seeing that from some of the numbers.
Within that lockdown period, yes, you've already somewhat alluded to it, that the testing wasn't aggressive.
Yes.
The results were not coming out quickly. Stakeholder interaction, was that adequate?
Thank you. You've touched on another important point. Now, our own position, I'm the chairman of the Medical Guild Lagos. That's doctors that work for the Lagos State government. We know that initially there was what they call the Emergency Operations Center, where there was some level of, but the interaction was not holistic. What we've said is that if we're going to get on top of this, we need interaction with the stakeholders, those that are actually in the field. And that has not been as adequate as it should be. And I'll just give us some examples. For example, at the initial phase, we saw the cases were few. So the concept of isolation centers came about, where you put people in isolation centers and you get healthcare practitioners, professionals to manage them, and we continue. But with community transmission, that system cannot work. Now, initially, the NMA had complained, even before the borders were closed. As a major stakeholder, they had complained that close the borders early. Because if you look at what happened in Taiwan that you were alluding to, what they did was, the reason why they have very few numbers is everybody coming in was under strict quarantine. We can't allow a situation where you just allow people to go to their houses and decide to quarantine themselves. Infection control mechanism may not be followed. That person may actually not get it or something, but if he finally develops it, the linens he's using, the infection control, the places he's touching, does he know how to do all that? So that was where we missed it initially, and NMA has spoken on that. Secondly, now that the cases have started spreading to the community, part of our recommendation was that every healthcare worker is now a frontline healthcare worker. Because once you have cases in the community, what you have is you are having community spread. So somebody could just present to a hospital, and that's what went on before we picked it up. Someone presents to the hospital, he has some fever, he has some difficulty in breathing. Number one, you can't get him tested as quickly enough because you need results real time. You don't need a result of he's sick, you need to treat him. Now, we explained that every frontline worker should be designated as, every healthcare worker should be designated as frontline workers so that they could get all they needed. Number one, adequate PPEs, personal protective equipment, the gloves, the masks, the disposable gowns, and things like that. They needed to have been brought on board quickly. Secondly, the government started with some form of incentive for those in the isolation centers. And we've made a case that, thank God the federal government is already picking up on that other healthcare workers too that are working need to be motivated. Because if you have a system where they are not motivated and they feel they have been neglected, they pull back from being part of the response. The response seems to be only at the designated isolation centers. But people still need care in the other hospitals, be it the tertiary, the secondary, the primary, even private hospitals. They still need some level of care. Yes, the person may have COVID, but he may have diabetes. The person may have COVID, may have hypertension. So all those things were not taken into place because that real stakeholder engagement did not take place.
The bit about staying with the stakeholders here, do you think it was properly defined? Because when you say stakeholders in project manager, do you include the people?
Yes.
Those, whether ill or not ill, the residents of a location, the healthcare workers, the police, everybody, were they included? So when you say in stakeholder interactions, do you think there was enough interaction with the people in terms of creating awareness? Because you talk to someone who says, what is coronavirus? Hunger virus is stronger than coronavirus. Is it a question of awareness or a matter of choice?
Well, I think it's a little bit of awareness. And, we must remember that because we're in a global society now, most people were initially taking corona as seriously as it should be taken based on the pictures coming in from other parts of the world and the numbers. If you go to the United States, we're looking at so many deaths. If you go to United Kingdom, so many deaths. Italy, so many deaths. Spain, so many deaths. Of course, in Nigeria, when people were looking at the numbers, it seemed as if we're not hitting those kind of numbers. So people looked at it and said, okay, well, you're just dealing with 4,000 out of a country of 100 million people. You're dealing with 4,000 cases. you're dealing with 100 deaths, 200 deaths. People were already dying. But again, it brings me back to the first thing I was saying. The way you can know the true numbers in terms of people infected and people dying is by testing. So it was when, for example, look at Kano. Suddenly you just noticed there was an upsurge in the number of people dying. Nobody knew why they were dying. Everybody started running around. It was when they started testing them that they said, oh, we're getting very high number. It's COVID. So that stakeholder representation is why it's important for us to get it right so that the public can also understand what is going on. On my way here, I saw a lot of people without face masks. Some people are wearing chin masks. Some people are wearing head masks. Not covering, because once you say a face mask, it has to cover the nose and the mouth. But again, to them, they just feel that I'm not seeing those numbers. But again, now with increased testing, we've seen that the numbers are suddenly jumping. Again, everybody's becoming worried. So that is why we had explained from the beginning that we need to build on what has, the thing about corona that we need to understand, yes, it's a novel virus in Nigeria, but this thing has happened in other parts of the world. We don't need to make those same mistakes that have been made there. We need to build, yes, we know we are dealing with different society, we know we are dealing with different factors, but there are some basic underlying factors that, if implemented, would help to solve the problem. Number one, contact tracing. Number two, stakeholder engagement. And that stakeholder engagement, I agree with you, it can't just be medical. You have the medical stakeholder engagement, you have the business stakeholder engagement, but there must be a balancing point. And that balancing point must always tip towards the health-related one. Because if in a business, for example, you have 10 people falling ill or 10 people dying, whether you like it or not, that business is going to close down. Nobody's going to say, I'm going to continue working because I need to earn a living. So those are some of the recommendations that we, and our medical associations have made, that and then we must also realize that our decision-making has to be a little bit prompt. Sometimes in a pandemic, when you could make the right decision, but it's too late. Let's start with the border closure. Decision was made, but at what time? By the time it was being made, it was already too late. So many people were already losing the community. Then we now move to the issue of the lockdown. By the time it was made, there were supposed to have been some provisions, as I mentioned, that should have been on ground. The issue of testing, nothing was done about that. So we got into a quagmire. Now we've made another decision that, okay, we've relaxed the lockdown. Are we analyzing? Are we looking at the numbers? Even they said, okay, we could reintroduce the lockdown. Based on what? When is that planned? These have to be prompt decisions. And then number four, because of the increased numbers, the government is thinking, we may need to start managing people at home. Because those are some of the things that the NCDC Director General mentioned. Those are some of the things that the Presidential Task Force mentioned. Okay, you want to do that. Remember that the initial response should have been that everybody coming into the country should have been properly quarantined. That failed. So if that failed, how is this new system that is going to involve larger number of people going to work? And that is why we need to involve the stakeholders. For example, we need to involve the medical associations to say, okay, if this system is going to work, how are we going to ensure that it gets to the grassroots? It's not going to be something, for some of the educated people, yes, they may follow some of those instructions. But if somebody is living in a face-me-I-face-you environment, 4 other people in his room, how do you really explain to that person that is going to, you're going to manage him?
But some of the most educated people actually live in face-me-I-face-you. It might be circumstances that kept them there.
I understand. I understand. But the point I'm trying to make is that with these stakeholder engagements, we'll be able to look at some of these factors and immediately intervene. We need to avoid, initially when this whole thing started there was some political interference. We need to admit that. A lot of the people that could have prevented this, the rules were relaxed for them. You were talking about discipline. You were talking about the fact that the governor has come out with rules and regulations, social distancing, use of face masks. But are the elites ready to follow those rules and regulations? Because if the elites cannot follow it, it's difficult for you to tell other people. What we have tried to explain is, at this point in time, in any discussion that is ongoing, if we really want to make any progress on this, we need to involve everybody and all the stakeholders. And I'll just probably come to one of the issues I was talking about, which was the health workforce. As the medical guild the other time, we came out because we were trying to analyze what is the situation in terms of affectation of doctors, affectation of nurses. We've seen that we're having an increased number of healthcare workers being infected. Okay, what does that translate to? Remember that already Nigeria already had a shortage of healthcare workers. Before Corona, a lot of people were packing their bags and leaving, healthcare professionals, especially doctors and nurses. In fact, what stopped it was the COVID, because travel restrictions came into it. And a lot of people already have their bags packed, just waiting for that travel restriction to be lifted, and they move out. Okay, now you now have increasing number of them being infected, falling ill. What provisions have been made for them? Yes, we know that palliatives should cut across borders, not just for healthcare workers. But again, we've pointed out that if you cannot get the front line, which is now everybody, not just those in the isolation center, if you cannot get all of them on board, you are going to even have mobility from other illnesses. Because somebody could actually not have COVID, but have something. I mean, now if you have a fever, I don't think this is the best time for anybody to have a fever, because truly everybody's going to look at you suspiciously.
Yeah.
If I were to cough in this room now, probably you'll get me out of this place with immediate.
No, we won't.
So how do we now get this? And yes, the federal government did something. They came up with a holistic plan after meeting the stakeholders and said, okay, we want you guys on board. We want everybody to be working. They came out, the presidential task force discussed with the NMA, discussed with the nurses, discussed with other groups, and they came out with something. For example, those of us in Lagos State, we appreciate what the governor did. He did something about hazard allowance. I think he was the first governor to do it, but we're saying we need a holistic response so that people can be confident enough to, if I have an insurance now, I'm confident enough to say, okay.
But you guys have insurance.
No, the insurance that was done was for those in the isolation center.
Dr. Shodipo.
Yes, sir.
See,
didn't the commissioner say that it was for?
Let's not take this tied to only the medical person. Yes, they are the front line.
Yeah.
Let's look at the people.
Yeah.
I mean, someone sent a message how he went to the bank to get a token, but on Monday, but the crowd he saw there, he was like, "What?" He rushed back home. When Alera was opening, she talked about the fact that when they lifted that Monday, it was as if the prison doors were open and everybody was, boo. At the end of the day, what can be done? What should be done to get the people in tow with what's happening?
Well, we need public enlightenment, and this public enlightenment must go
Orientation agency.
Yes, with statistics.
You're being called out again.
There's nothing you're going to tell somebody that is not working that something is so dangerous and he can't see the effect of that danger. I'll use the example of even fuel tankers when they turn over and fuel is leaking. People still go there to scoop fuel. Yeah. What really stops people a lot of times when you just hear there was an explosion, I don't think I want to really have a burn injury. So already we have some deficiencies in that as a people. So we feel that with increased statistics, and that statistics can only be gotten by increased testing, that's number one. We also feel that, yes, it was good that some palliatives started coming in, especially but those palliatives need to be targeted at the most vulnerable. And those palliatives don't necessarily have to always be direct cash handouts. That is one option. We're looking at other things. Part of our own advice is, even for other people, can we get some tax exemptions? Remember that I mentioned, I don't want to go back to health, but I need to mention it because it affects all of us. Even our private hospitals, they're still running, they run based on how people come to those hospitals, and a lot of them have been affected. Can we get some tax exemptions for small businesses and things like that? Can we get some, in New York, they talked about rent waivers. When your rent is due, your landlord is on your neck, you're a business, you need to pay rent. Can we find a situation where they say, no, give 3 months, give 4 months, and it's documented? So those are some of the measures that need to come in. The other palliatives is, can we use existing structures to reach out to those most vulnerable? It shouldn't be a political distribution. Sometimes in Nigeria, it shouldn't be political, it shouldn't be religious, it shouldn't be, I'm targeting those that I know. It should be really targeted at the vulnerable. It's true that we don't really have some of the statistics, but even for the statistics we have, can we use it to reach out to people? And then lastly, I think I just need this as a clarion call to all members of the public. Sometimes, like when the lockdown restrictions were announced, some of the protocols, they were so, sometimes looked a little bit complex. And, for us, they said one of the challenges for the Nigerian is, if you want to get information out, just write it down. Nobody's going to read it. Nobody's even going to hear what. Even some of us, I'm sure if they ask us the details, nobody has really read those things. So we need to just make 1, 2, 3, 4 points.
Bullet points.
Bullet points. Number one, everybody please try and use your face mask, especially when you're in a crowd. I think that's as simple as can be explained. Number two, the issue of hand washing or use of hand sanitizers. As frequently as possible, just sanitize your hand. I had my bottle, I just left it outside. Every 5 minutes, I'm spraying my hand, and people are wondering what's going on.
We have
yes,
one.
And there's
I have one in my bag.
So
you can use it
because
if you wish.
you could touch a surface, you could this. So it's very important. People need to get that. Number three, if you don't really need to go out, this thing has opened our eyes to the fact that some of the work we actually go to the office to do, we could do it at home. Yeah. You have your computers, if you're an ICT based, Can you have meetings at home? Do you really need to gather everybody?
But you think about it when you have light and water. I mean, light and internet.
Yeah, but the truth is that some people have that, but still let me just take a stroll out. I was passing by my area yesterday and I saw there was a hotel and they were like having something like a party. I don't know. I just saw people gathering, talking together.
Especially men.
Well,
Men.
I don't want to go gender. I don't want to go gender.
They don't joke with their beer, do they?
Well,
They must go drink beer after work.
yeah. So please, if we need to drink beer, buy your bottles and put them
And drink at home.
Okay.
Don't come out and say I must, and then don't think that the beer is actually going to kill corona, because some people thought about alcohol, being one of the, since they said alcohol hand wash.
Yeah.
Why don't I just use alcohol internal
Okay,
wash?
that's
Which
actually
is inject yourself with disinfectant, according to Mr. Trump.
We'll take a moment. We'll come back, continue this, the pros and cons. Please stay with us. Thank you for staying with us. So this tweet comes in. Samson Oderinde says, I would rather blame our system that is not proactive. They're talking about the policemen. So the policemen were not told what to do with lawbreakers at the state borders. As they become extremely overwhelmed, they are left with no other option but to discharge defaulters and also help their own pockets. Festus Akimboewa says, Governor Bello is living in denial that there is no COVID-19 in his state and it's not good for anyone. Dr. Duaya says, good morning, guys. Please, just a quick one. How often does one need to sanitize his or her hand? Is it as soon as the applied one dries off, or when? You can quickly answer that one. And then.
All right. Well, for the hospitals, we talk about at least five times once you are with the patient, But I think generally, as frequently as possible, because we must remember that the way that COVID is actually spread mostly is through surfaces. So you touch something, inadvertently you're going to touch your face, and that's why they said the mask, is very important, and then you sanitize your hands. Of course, some people have gone a step further to start using gloves. Personally, as an association, and as a specialty, we're really concerned about the issue of gloves. Simply because when people use gloves, they don't actually use hand hygiene most of the time. And that glove could actually now be a mode of, so if, for example, if I touched a surface that had COVID, and I just keep on going everywhere and I'm touching, I'm just spreading it. And that's why we've also explained that, for example, everywhere, they should ensure regular cleaning, and not with just water, but add some level of, jig, that's sodium hypochlorite, add it, and regular cleaning, bleach. Regular cleaning
the use
every
of
2 to
gloves,
3 hours. Yes.
Gives you a false sense
It gives a false sense of security. And you could be endangering others. Yes, you might be a little bit protected. But now you see people, they're using gloves. Next thing, they're touching their face with that same glove that they've been using to touch everywhere. But if you've washed your hands regularly, you have a hand sanitizer with you, every time, just take it as, it's almost becoming like, a kind of situation where maybe every 2 to 3 minutes, you're just sanitizing your hand, you're cleaning your hand, because you don't know what you're going to touch.
3 minutes?
Yes, you can't do that as frequently as possible. That's for the hand sanitization. We know for washing of the hands, it might be difficult to wash your hands, but once you get the opportunity, ensure you're washing your hands. Because sometimes you've been using sanitizer, when you get to wash your hand, the dirt that comes from your hand, you'll be surprised that, I thought my hands were very clean. So that's important.
Okay, Doctor, let me take you back a bit. We are a peculiar nation. Back to the, lockdown. Some people have said that we were actually on the verge of having a revolt just before the lockdown was eased. People were hungry, and actually there were videos that had gone viral. People standing on the streets and saying, we are going to revolt. There's going to be they're not looking after us, and they say we should stay at home. How do they want us to eat? We were on the verge of that. So some say we were actually at the point where the lockdown had to be eased because people were hungry.
Well, you're right. And I think most of us experienced it. I mean, though a lot of people started intervening on their own to salvage the situation. And that's why I initially started with, why did we have the lockdown? Truly, it might be unfair to everybody if you have a lockdown and the objectives, I use another example. Somebody was given a 2-week leave to prepare for an exam. And there was no textbook for that person. So he spent the 2 weeks sitting down at home. And then after 2 weeks, he has not prepared for the exam. And he still has to have an exam. So that was what happened. What we wanted was that as that lockdown was going into effect, there should have been stockpiling of sample kits and their materials that are needed, because it's not just the testing, there's a sample collection point and everything necessary for contact tracing, so that we would have used those, because it's not just that we want to keep people at home just to keep them at home. We would have used that period to achieve the objectives. Unfortunately, as I said, that did not happen, and that's why we are where we are with the community transmission. But be that as it may, even the most vulnerable, those that have socioeconomic class issues, the most vulnerable should remember one thing: they are still at a disadvantage. If you look at the trend of COVID all over the world, the highest group that are dying are the most vulnerable. In the UK, they've looked at blacks, they've looked at other minorities, because they have lower socioeconomic power and they live in poorer socioeconomic areas. Secondly, somehow, unfortunately, they also tend to have more comorbid conditions. Remember that COVID, we've seen that some of the things that lead to serious illness, diabetes, hypertension, obesity, immunosuppression, things like HIV and co. Now, if somebody is even diabetic and he has money to buy his drugs, fine and good. Somebody is diabetic, was of the low socioeconomic class, he could not even buy his drugs, the lockdown has been eased, the person gets infected. I mean, it's your guess as good as mine what's going to happen to that person. So I think everybody understands. But again, another thing we've also tried to explain is that there must be transparency. We must start having situations where everybody in the populace knows what is going on. You know, sometimes people don't know. They are just rumors flying around. And once there are rumors, everybody's going to assign it to how they believe it. So we feel that part of what should happen is the challenges should be listed out. The solution should also be listed out, so that everybody becomes a stakeholder. The person in the committee says, oh, excuse me, everybody here, can we just wear masks? Not because the government is telling us to wear masks, but because we can protect ourselves so that we don't fall ill. Because if we fall ill now, the chances of having a worse outcome are higher because the hospitals are being overwhelmed. So I think that the risk communication has to also change. But again, it can only change if everybody is taken along as a stakeholder. We shouldn't politicize it. It shouldn't be, initially it started as those rich man's disease, because everybody coming back with it were from abroad. Now it's got into the community. Everybody is at risk. So we feel that risk communication has to come in so that everybody sees themselves as a stakeholder. You are not forcing me now to wash my hands. I know that if I don't wash my hands, I could fall ill. I could infect my family. I could infect my loved ones. And if they fall ill, there may be nothing we can do. So those are some of the things that I personally think and the association thinks would improve that.
Yeah, but the way things are panning out, one gets the impression that the people think that they are doing this for government. They are doing this for somebody else.
Exactly.
Because it doesn't look like the communication out there is giving the correct information to people. I mean, I'm going to wash my hands because they say I should wash my hands.
Exactly.
I'm going to sanitize. I'm going to wear mask because they say I should wear. To your mind, is there adequate communication of the effects or of this disease?
The attempts have been, there have been some attempts, but more still needs to be done. And I'll keep on reiterating that we must get all stakeholders on board. We must have regular meetings with all stakeholders. This cannot be, okay, I met with you last week or 2 weeks ago. We must get every single person from top to bottom on board with regular communication and risk communication. Remember that even some of our political leaders have been giving mixed messages. There are so many videos that have gone viral where someone says, it's not even some governors have gone out to say, this thing is not even real. I mean, we can just go over it. So that risk communication must be clear and sacrosanct. Number two, we must also ensure that we do what is necessary to convince people. And the only way to do that is by testing. There is no other way.
Unfortunately, we don't have enough test
Well,
kits.
we need to somehow get these test kits. I know it's difficult, and I want to also use this opportunity. I know some of the donors have been trying to say, okay, we're giving money. Sometimes you even have the money, you can't get what you need. Can somebody just say, okay, please, we're donating, like I think in River State, we saw where, I think it was Shell, they donated a PCR machine, they donated test kits. So for some of the international agencies that are coming in, beyond giving money, which is important, can you just say, okay, we have given you 100,000 test kits. That solves a problem on its own. Number three, how do we now have proper provision of other materials that we need? personal protective equipment. We can't run away from it. If we want our healthcare system that was already in bad shape not to even collapse.
But we have local manufacturing of the PPEs.
Well, if they are local manufacturing, are they being verified by SON? Because, it's one thing for me to give you, it's not like when the issue of face masks first came about, a lot of debate. Is it really protecting me? Even right now in the hospital community, we have this big debate. We have two types of masks. Sorry, I didn't bring them. We have what we call the N95 mask. We have our surgical mask. Serious debate. If I wear a surgical mask, am I being protected? So you can even give me 10 boxes of surgical masks and I say, excuse me, you are not protecting me enough. So we need these things to be verified quickly. This cannot take the normal bureaucracy of submit it, pay one fee, and somebody. Because even if you give out 10 million masks, if people feel that it's not protecting them, they're not going to use it. So I think that also needs to be done. And then, while we are rolling out palliatives for the community, I think we need to, as we were discussing, make it targeted. The most vulnerable first. It's a difficult process. I'm not trying to say it's easy because Nigeria has never really had data. But we must find a way to keep on working at it. And then, of course, we also now have to ensure that we make our decision-making on this pandemic very quickly. We can't have these as somebody said, retroactive. We must be proactive. We must think ahead that, okay, what did South Korea do? This thing is not rocket science. What did Taiwan do? People that have gotten over, what did Denmark do? They all had lockdowns, but they didn't just keep people at home. They did aggressive testing. And then they strengthened the hospital community. I have to speak for my community. Everybody will speak for theirs. The business community will speak for theirs. A lot of our colleagues are worried. For example, when I get home sometimes, as I'm getting in, my kids want to come. My wife says, don't do that. Your dad could be infected, which is true because I go to work every day. And even now, the kids know that once he's coming, just leave him until he has gotten into the bedroom and he has taken a shower.
So we could also speak for our own community too.
Please, I think the best to shoot. So what we are saying.
In closing,
yes.
Has there been any improvement in the provision of PPE for you guys?
There was a little improvement, but our alarm, we also have post-lockdown surge. By the time the hospitals are open fully, people are going to troop into the hospitals. Now, that little PPE we had cannot sustain that. And that's why we've talked about the fact that I think I just need to end with this. Please, as we are looking out generally, let's also look out for our health workforce. We must have our health insurance for all. We are all frontline healthcare workers. Our health insurance, please, there must be discussion, especially for those of us in Lagos State, between us and the government, because we are like the Wuhan of China, we're like the New York, where most of the cases, more than 60% of the cases are here, and our people are tracing.
Thank you
so much.
Okay, well, I must say that we do appreciate the work that you all frontline health workers are doing. Thank you very much. You put your lives on the line to save us, and we do appreciate that sacrifice. Dr. Oluwajimi Shodipo, Consultant and Chairman, Medical Guild, Lagos. Thank you very much for coming to talk to us this morning.
Please, I just want to thank Channels. I watched one of your documentaries where you talked about somebody in Jos that created a machine that you could use your feet to control the water, the hand sanitizer.
To wash hands, yes.
Those are the kind of things that we really need, all these issues. So we have local solutions. And we thank you for the work you are doing too.
Sunrise will be back in just a moment. Do stay with us.